The Italian population, we have a high percentage of patients suffering from chronic pain. In particular, this is even more true in women. If we consider housewives, 1 out of 2 suffers from chronic pain, and we see that there are gender differences in pain, and they play a role, and they are due to biologic differences, genetic aspects, psychological aspects, social conditions, cultural problems, research bias. So the topic is there are reasons why women perceive pain in a different way, but there is also a gender difference in onset of painful diseases and a gender specific response to treatment. If you look at this slide, you might see the predominance in women of painful diseases compared to men. Some diseases are being studied quite recently, in particular the chronic pelvic pain. Until few years ago, it was not particularly considered. Very often it was hard to find a cause or the etiology. There were no injuries, no inflammation. And so very often women patients referring pelvic pain were considered as psychiatric patients, and they were managed by the general practitioner. They were managed with benzodiazepine that were pretty much widespread over the past. So the chronic pelvic pain has a percentage of 25% in the population, exactly as asthma and back pain. By talking about gender disease, we understood the investment of the health word in this and how much we were working on gender equality. By reading the WHO material talking about pain and gender disease, a relevant aspect that is now entering the Italian society as well concerns the pain and diseases due to female genital mutilation, which usually happens by the age of 5, and this can underlie the chronic pelvic pain, and of course in this case the origin is clear. So this pain is also related to violence against women. And what can we observe? That behind a large portion of patients suffering from chronic pain, we find sexual abuse, which of course also creates a lack of trust, sleep disorders, self-harm, but in 25% of cases is also related to recurrent pain. And in particular, these pains are linked to the pelvic area. So since there was the association between pain and sexual abuse, we studied literature to find an association, a relation between child abuse and chronic pelvic pain. So an ACE study compared two populations, one suffering from pelvic pain, chronic pelvic pain, and the other was the healthy control. You see 421 patients, 233 were women, 414 in general, 232 were women in controls, healthy controls. So on this population, they carried out an assessment, and the ACE severity score was developed in order to assess how many people under 17 were exposed to adverse experiences during their childhood. You see the score here, which involves several interesting aspects. And we have to highlight that when we talk about chronic pelvic pain, the population suffering from this pain is often related to physical abuse, injuries, and sexual abuse. So children who suffered from this type of abuse then develop in the adult age some chronic pains. And the critical aspect is that on our side, as general practitioners, adult-oriented, or pain specialists, but there's a poor awareness also concerns specialists, because not all urologists or gynecologists are aware of this issue. Not all of them recognize that behind a chronic pain there might be sexual abuse situations or physical violence, or even in a smaller part, sometimes just stressing conditions. The relevant aspect when we have to face ourselves with these patients is that we rarely look for these experiences, and not always the patient is willing to talk about it.